8:24. Welcome back to Tuesday's BT. Days away from the Walk for Arthritis that takes place back here in the Olympic Village this Saturday. And joining us right now, Eileen Davidson, living with arthritis but using your voice in a major way. Welcome to you, Dr. Kam Shojania as well. This is our chance to really talk about what is happening with arthritis, what's changing in terms of the treatments. But Eileen, let's start with you. April 8th, 2015, you outlined this on your blog. How did your life change?
Well, it completely changed because I learned what arthritis really was. Before, I thought it was just joint pain, but it really is so much more. I didn't know that rheumatoid arthritis was an autoimmune disease that could very well affect me in ways that I never imagined. I saw my aunt always in a wheelchair, and she passed away the same week that I was diagnosed, so that really terrified me. I didn't know rheumatoid arthritis came with such a emotional mental health burden as well, and then it landed me on disability, so that really affected my life as a single mother to a then 2-year-old.
So many responsibilities in your personal life, being a parent, dealing with this day to day, physically and emotionally. What is the struggle like today?
Today, well, I have to be very diligent with my self-care. Taking care of arthritis is a full-time job in itself. I have to exercise daily. I find I have to eat healthy. I have to keep a positive attitude through some tremendous pain, through depression, anxiety, tons of fatigue. Fatigue could be sometimes the biggest problem for me, even though I'm okay with pain. It might be just the fatigue that's wearing me down, and the energy of rheumatoid arthritis and a toddler don't mix very well, so it could be a challenge.
Parenting in itself is a big challenge. Dr. Kam, as you hear this, what's changed year after year? There are events that take place, but treatments for patients living with it to make life a little easier as we work towards an end cure.
I think what's changed is that we understand that for everybody with arthritis, the two most important things are exercise and healthy diet, as you said, and I'm so impressed with how you're doing it. For some types of arthritis, early diagnosis, because we can treat some types of arthritis early on and actually stop the disease in its tracks. So in addition to lifestyle measures, being assessed, early diagnosis, and treating with old and new medications can really stop the disease in its tracks.
What are some of the common misconceptions about this condition?
I think the most common misconception is young people don't get arthritis. So we have pediatric arthritis specialists here. We have an arthritis program at Children's Hospital. So young people do get arthritis. The other misconception is that nothing can be done, and that's, I think, the biggest misconception.
You see this banner on the screen, Canada's largest chronic health condition. It's a serious thing, and Eileen, for you to turn this condition into a voice, how have you, and what is the impact you've heard from those living with arthritis as you've shared your story?
Well, one of the first things I decided to do was to fight my disease, was to get a gym pass and exercise, and I ended up losing about 60 pounds and becoming an advocate. So I've been able to inspire others around the world to be more active, and I've shown them just through my social media presence that I've found so much pain relief. It might not be perfect, but it's gotten me this far, and I'm just so impressed that I'm able to get other people who are suffering with this pain to get moving.
Well, your voice is going to be shared. The Walk for Arthritis takes place this Saturday over at Olympic Village. Our own Mary Cranston, she will be hosting. I had the privilege of being there with the group last year, and I was so impacted by the personal stories, the sense of community of how everybody comes together to help, share stories, share resources. These events make a big impact, and Cam, if you could just outline for anyone showing up to the walk, the difference it makes with the research being done.
Well, as Eileen is working with Arthritis Research Canada, which is doing, headquartered here, it is doing amazing research both in lifestyle, in medications, in population-based interventions that improve arthritis. And the Arthritis Society is a major funder of Arthritis Research Canada, so the money will go to that type of research.
Your chance to make a difference this weekend. Big thanks to you two for coming by. And Eileen, thanks for your courage to share your story and be a voice for good.
I hope it makes a difference.
All right. Saturday's your chance again. Going to take a break. Top news stories coming up. But first, we'll check in with Greg Harper.